Our next two speakers is Dr. Neelam Bhalla and Lerisa Villaflor. Dr. Neelam Bhalla is a wonderful colleague of mine. I know her for about 13, 14 years now, and we have worked together on many projects to take care of our peritoneal dialysis patient, Kaiser Permanente. Currently, she is a nephrologist at Kaiser San Leandro, Haywood area, and she is the champion for our home dialysis patients. And Neelam, the floor is yours.
Thank you, CJ. I want to thank you and the National Kidney Foundation for the invitation for our team to talk about assisted PD. We will be sharing with you our experiences, our successes, our learnings from the assisted PD over the last 3 years. So our comprehensive discussion will include Lerisa Villaflor, our wonderful PD nurse who has been engaged with this endeavor right from the very beginning. And to further enrich our discussion, we are very fortunate to have one of our peritoneal dialysis patients, Mr. Russell Obi, who will be sharing his thoughts and perspective on his experience with PD Assist. So I'm going to start. My title is Assisted Peritoneal Dialysis, Making Lives Better at Home, Indeed. You know, I'm not able to move my slides. Click on the slide, sorry. Okay, so I have nothing to declare. So I'll be talking about our objectives and goals that we had when we started our program. And I will also share about what's happening in the world with assisted PD. There are several countries in the world who have been doing assisted PD for several years. And that is where I got all my inspiration from to start the program here. Then I will follow with our own local experiences. And as part of that, Lerisa will talk about all the patients and some of her experiences and what happened when she actually went into patients' homes and assisted. And then we'll have Mr. Obi's perspective. And then I will summarize with what we could do better and what our challenges have been. So our objectives were to overcome barriers and promote PD utilization in the elderly. As we all know and have experienced, we have many elderly patients on PD at this time. And it's our elderly patients that are frail, that are anxious, that get easily overwhelmed, and they may not have a caregiver at home to help them. And we wanted to really have this patient population be successful on PD. We also, our second objective was to help patients who are unable to do PD themselves, say for if they had a medical problem like a fracture or they were in the hospital and were weak and they needed some rehab time for a short period of time so that we could help them. Or if they're living with a caregiver or a family member who's doing it for them, but is unable to do it because they had to go on leave or vacation or they were just burnt out. So our ultimate goals were to reduce transfer of these patients to hemodialysis by doing PD assistance and to expand peritoneal dialysis as a modality of choice. And this is for patients who already were dialysis candidates, and this was in line with their goals of care. So worldwide experiences, I don't, this is a very busy slide and I don't expect you to read everything. I just want to just point out that countries in the world, France, Denmark, Italy, Canada, Brazil, China, India, they have 10 to 20 years of experience in assist PD. And there are different models in each country. So for example, in France, they have a private nurse, which is reimbursed directly by the French healthcare insurance, who does home visits with assist PD. And the type of training that they're given is also different, right? So they're given just 2 training sessions in France. In Denmark, there's a community nurse who's paid, and also nursing home staff who can go to patients' houses. And they are giving only 2.5 hours theory and practical experience. In Italy, it's nurse assistants that are doing it. In Canada, there is a mixed model based on patient complexity. In Brazil, again, there are nurse assistants doing it. And in China, it's mainly family members or other home assistants. So there are different models. The type of PD that is provided, the caregiver, the type of training, and what resources they have determines what kind of a program or a model they'll have. So for example, like I said, France has over 20 years. In fact, this was the first country in Europe that started assist PD. Denmark has 15 years and the staff does 2 daily home visits. Italy again has 20 years. They provide supervision at home, assess patient adherence, and they assess the home environment. They also train nursing home staff. And in India, this program started in 2007, and there the paramedics actually who are trained go, do weekly visits initially they'll do after a week, and then every 3 to 4 weeks, wherein they will check, the room, the vital signs, and record images of the exit site. And in Canada, there's a mixed model. So in that, it is distributed between nurses and nurse assistants, and and who goes to the patient's house is determined by the complexity and needs of the patient. And they really thought that the home care assistants increased the PD eligibility by about 15%. And in Brazil, started in 2003. Like I said, they have nurse assistant. 1 assistant is for every 4 patients, and they do 2 daily home visits. And in China, it started in 2012. So like I said, it's been going on for a long time in other countries in the world. So what are the outcomes, in the sense that, are these patients hospitalized more? Do they have higher peritonitis rates? What is the technique survival? So they also did a study, and it's variable, but the peritonitis rates were really in line with the guidelines. They varied between 1/25 to 1/36 patient months. Canada reported lower with assisted PD versus self-care PD, even though Danish reported the opposite. But when they increased the nurse frequency of visits, the peritonitis rate dropped. In France, again, it was associated with a lower risk. Technique survival rates were 58%, 81%, and 96% at 1 year. As was reported by the different countries, French, Canadian, and Brazil. So we cannot complete any kind of outcomes without discussing quality of life. So the frail and elderly patients' outcomes on dialysis study revealed that there was similar quality of life and physical fitness in assist PD and hemodialysis. And but the satisfaction scores were higher with assist PD than with hemodialysis. So that was some of the observations. So coming to our own experiences in Kaiser, we take care of about 170 plus peritoneal dialysis patients. So we started this pilot in 2018. Our goals were, as I discussed, um, we wanted to help overcome the barriers to PD and support the non-self-sufficient and elderly patients to utilize PD and to help them and remain on PD. And so what we did was we had a 7-month pilot. It was a time limited assistance. We provided assist PD for about 90 days. We developed some patient selection criteria. I've detailed it on the next slide. We identified a PDRN, which is Lerisa, and she will talk to you soon. And she has been very, very enthusiastic and has done a wonderful job. And so she was trained, and she volunteered to do this. And the assistance she provided included cycler setup, connections, CAPD exchanges, lifting bags, adding antibiotics, training and retraining patients, and even training caregivers at home and providing psychosocial support. So our patient selection for the pilot, for prevalent patients, we gave this assistance to for respite care for medical conditions. Say a patient had a fracture or underwent recent surgery or had a stroke where he was, couldn't do his PD, we help them out. Then for respite care for caregiver going on vacation or leave. Then for respite care for psychosocial reasons, if patient was undergoing some sort of a social issue at home, whether they were, in the middle of some stressful situations, and then also providing follow-up on non-compliant patients. For our new patients or incident patients, we selected patients who were urgent starts, who needed assistance with exchanges because they were so overwhelmed, because they were urgent and were nervous and anxious. And so a gradual transition to home by doing visits just like India does. Is that what we did? We did, say, 2 or 3 times a week in the first week, and then slowly wean them off as they became more confident. And then the same thing, providing in-home support in the first few weeks of training. And for patients who were elective starts, those patients who had some challenges with, caregivers or some barriers and needed support, we did that. So in 2018, we assisted 16 patients with a total of 59 visits. The reasons were, 7 patients, anxiety, 1 patient had an ankle fracture. There were 4 elderly, there were 3 who had peritonitis, and 1 just respite care. Visits per patient ranged from 1 to 10. 7 were new patients and 9 were prevalent patients. Results. So 8 of them stayed on PD. So about 50% stayed on PD. 2 switched to hemodialysis. 5 expired and 1 relocated. So we were very encouraged by the fact that by using PD Assist, we could retain 50% of our patients on PD who would have otherwise had to transfer to in-center hemodialysis. And we know that once patients go to in-center hemodialysis, it is very challenging to get them back on PD. And so we realized that assisted PD is a valid and safe way and an alternative to in-center hemodialysis and should be used to overcome barriers and make sure the patient can stay home doing his home dialysis. And if they are fearful initially, they can still do PD after some PD assistance, and to encourage them to be more confident in this home therapy. So then we restarted it in November 2019 under the umbrella of home health, because we realized that this needed to be done under the home health umbrella. So we did one patient in 2019, November to December, and then we could do only 5 patients last year because of COVID, because of the pandemic. We had to hold off on doing this, and we have done 8 so far in 2021. Our reasons, included weakness due to hospitalization, respite. Some patients had memory issues, frailty, anxiety, and then the number of visits for each patient was 3 to 9. So the type of assist that was given was, cycler setup and connections, supervision of therapy, guiding the patient, training the patient, retraining the patient if they needed some training in the comfort of their home, and also helping them with IP antibiotics if they had peritonitis. So our outcomes so far, 3 patients who were assisted in 2020 died because of cancer and sudden cardiac death, and 1 went to hospice. And the patients who've done in 2021 are all still on PD. So good. So now I will request Lerisa, our wonderful PD nurse, who has been our PD assist nurse for these years and has done a great job. She also, in addition to PD assist, does follow our CKD PD patients and does in-hospital education. I will request her now to talk to you about her experiences, because she's really boots on the ground and she's the one who goes in to assist the patients. Lerisa?
Yes, Dr. Bhalla, thank you. Good afternoon to all. First, I want to thank the NKF and Dr. Bhalla for inviting me to share my experience as a PD Assist RN in our Peritoneal Dialysis Assist program here at Kaiser Permanente Peritoneal Dialysis Department, Hayward, California. My name is Lerisa Villaflor. I have been a registered nurse for more than 20 years, with 12 years in nephrology and a PDRN for 8 years. Currently, I am a peritoneal dialysis assist nurse under the umbrella of Home Health Department, with overview from the PD department and follow CKD patients. Way back in 2018, Dr. Bhalla and my manager, Elaine, discussed the initiative to start a PD Assist program and asked me if I was interested. I was eager to help. It was a new opportunity, a new experience, new exploration, and that we were the first one to do the PD Assist. So of course, I'm for it. So I want to share my workflow, the challenges, and some patient experiences with you. Who and how we identify patient needing PD Assist. So patients interdisciplinary team that includes, of course, the nephrology, the primary PD nurse, the social worker, and the registered dietitian. They discuss the need during the care plan meeting. And if the primary PD nurse feels like the patients need it, they will discuss the detailed reasons why PD Assist is needed with their nephrologist and, of course, with me. So our patients can be new, who are overwhelmed and anxious starting at home, who are elderly or fragile, MBPs, or the most vulnerable patient. If they have change in medical condition, with infection, if they're unstable, needing some respite, patient with family or caregiver that needs to get the training at home. So I remembered way back that just to lift bags for a patient when his entire family went on vacation was also assisted, and he really appreciated that. Again, if the team feels like our patient will benefit from PD Assist, it will be referred to me. So once I'm aware, I talk with the patient if they are in the clinic and I am available. If not, I will talk with them over the phone to discuss about PD Assist. What are their needs, when to do the initial visit, and making them aware that it is temporary. I also inform them that while doing PD Assist, I will be the one in charge with their peritoneal dialysis treatment. So when patient agrees, a formal referral is sent to home health department by their primary nephrologist. During the initial visit, post or after signing the consent, I will do a thorough assessment. I will check for availability of support. I will check the home situation, the environment, and of course, I will see what resources we can use to, for them if it's needed. Patient is also informed of the frequency of visits. The plan and tasks to be performed are also discussed. So I give an updates to their respective nephrologists. I send a case communication, and that includes the plan of care, and most of the time they approve it. I also give verbal updates with their primary PD nurses, and I also give simple updates during our daily huddle with the other nurses or the other team. Patient's duration and frequency are based upon my assessment. Initial visit is the longest, at least it usually takes at least 4 hours because of all the documentations. Succeeding visits are ranging from 1 to 3 hours, and number of visits varies as well. So maximum of 2 visits per day, especially if part of the plan is to start APD or dialysis machine at home. And usually patient will be connected during the daytime for approximately 5 hours. And then in the afternoon, I will come back and disconnect them. And if I need to retrain the patient or train the family member, the visit can range from 3 to 16. And the allowed maximum visit that, with my workflow is 90 days. So of course, I also have some challenges, but overall, there's only few that I encountered. And most of the patient actually and the family that were assisted, they really appreciate the help that was given to them. But I want to say, I think I identified 3 challenges that I want to share with all of you. The first one is issues with benefits. So there was one patient of ours that felt like he did not need me in their home. Reason for the referral was multiple hospitalizations, secondary to fall and weakness. So upon assessment, patient was still able to do his peritoneal dialysis treatment. I offered to train the wife and or any family member to be his backup, but patient refused. States children are busy at work and cannot do the help. Wife is also anxious and claimed she is not capable of doing it, though she is helping the husband or the patient to bring the bags for him or lift the bags for him. But then at the end, I learned that wife does not have any medical insurance and does not want to get stressed and not to end up in the hospital herself. So the second one, home health insurance with their coverage. So when one of our patient was missing in action or did not follow up with us, as expected, he ended up in the hospital. And of course, he started as urgent peritoneal dialysis because he doesn't want to do hemodialysis. Her daughter was the one who get the training, and she was the one who did everything for the patient. So she got overwhelmed and requested an assist at home. Patient states it is not that he does not want me to be there, but he just wants to make sure that I will not consume a lot of his home health insurance coverage. Hence, after 3 visits, he requested to be discharged and requested to just come in the clinic if it's still needed. So the last challenge that I believe up to now that everybody's encountering is COVID. Okay, so of course, as much as possible, we want our PDSS program to be successful. But due to unfortunate events with this pandemic, after seeing 2 or 3 patients since we started, we needed to stop and not to take the risk of contracting COVID-19 for both the patient, family, and myself. Fortunately, I am already back and seeing patients since last quarter of 2020 with proper precautions and screening prior each visit for PDSS patient and also following home health regulations in terms of preventing COVID. So I also want to share patient experiences, some situations, scenarios with the PDSS I did. So the first one is Miss JJ, 74-year-old, assisted last February of 2020. She had an issue with her PD catheter and underwent revision ×3. And it is ×3, same week of hospitalization. So of course, upon discharge, she is very, very weak. So I did a CAPD at home right away, make sure that her PD catheter will work very well. I also trained her daytime caregiver, and I believe I had a total of 11 visits with her. And patient stayed with us for more than 1 year. Unfortunately, she went on hospice and passed due to other medical issues a little more than a year after the assist. So another patient is Mr. LV, 74-year-old patient doing PD independently for 4.5 years. So he got COVID-19 infection, ended up in the hospital, and then he also has a chronic knee pain that got worse. So his health deteriorated after the COVID. He went to SNF for short-term rehab, and he went for backup hemodialysis. But patient requested to be back in doing peritoneal dialysis. Unfortunately, he became too weak for it. Wife decided to get the training in the clinic to do PD for the patient. She got overwhelmed and feels like she's unable to do it. She canceled some of her training appointments in the clinic, and then I started PD Assist. So wife got the training at home with APD, or the machine, last August of 2020. I had a total of 13 visits with her. Wife was able to adjust well at home with that PD Assist. Patient not able to recover with his ambulation. He's already bedbound. And she's still doing peritoneal dialysis up to this date, actually. So the other one is Mr. AV. He is 73 years old. He's a Chinese-speaking patient. Wife was the one who got the training, and she's very, very anxious, and she's very afraid to start at home. So she wants to make sure that she will not make any mistake after her training here in the clinic. So for her, I did the initial setup of the machine. But the following visit, I just guided the wife step by step until she gets comfortable doing it independently, and they also transition at nighttime. And after that, I discharged them. So I think I had a total of 7 visits with them. Another patient that I want to share is Mr. JA. He is a 75-year-old Spanish speaking. Wife is very supportive, but as per primary nurse and discussion with his interdisciplinary team, patient is having hard time picking up the teaching, able to learn CAPD slowly. And the goal for me actually when I started the PD Assist is to let patient do CAPD at home comfortably with my guidance. and then to train patient and wife with AMIA. So patient really appreciate the assist and states he will save money, for the gas and no need for them to come to the clinic. So as of now, patient adjusted very well. He said he's feeling perfect and is back behind the wheels. So, and wife states also that patient changed a lot for better since he started the full treatment of peritoneal dialysis. The last but not the least that I want to share is Mr. R.O. As of now, he is 81 years old. He is very independent, but very anxious starting at home initially. And he also wants to make sure that, when he do it at home, that everything will be all right. Everything is right. So actually, as of now, he is still doing it independently. Currently, I am very satisfied with what I do. Doing PDSs as part of my job, I feel like I have a realistic understanding of my profession. I know being a nurse, we should have the ability to understand others' needs. Everyone is different. It is very challenging going to patients' houses because I do not know what to expect. However, I feel like the source of achievement gained in this fortunate role outweigh each challenge I am facing as a pediatric nurse. I am happy that in this role, I can provide even a small comfort at a time when patient is most vulnerable. By the way, an advantage maybe for me, most of them are my CKD patients that I followed up together with their nephrologist before they start dialysis. So I pretty know most of them. So yeah, so I think that's all for me for now. Thank you so much. Anybody have any question?
Thank you so much, Lerisa. That's so wonderful, so touching. We are so fortunate to have you with us, taking care of our patients. Really wholeheartedly thank you. Neelam, that's wonderful. Yeah, our nurses are our treasure, the angel of this world.
Right. I agree. So now we have our Mr. Obi, our patient who got PD assist with Lerisa and would like to say a few words. I think Lerisa will maybe ask him some questions and then he'll give his perspective. And Lerisa, where is Mr. Obi?
Here, he's fixing himself. All right, Mr. Obi, coming down.
All right, Mr. Obi, we're all ready for you.
Welcome, Mr. Obi. Thank you for joining us.
Let me just put
So Lerisa, you want to start? You're going to ask him questions.
Can you hear? Can you hear them right now?
Yes, I can.
Yes. Yeah. So can you hear Mr. Obi okay?
Yes.
All right, okay. Yeah, so I just have so Mr. Obi actually is the first patient that I assisted. That time he was 80 years old, or 79 turning to 80. And then, of course, I want to say thank you to him for joining me and Dr. Bhalla during this NKF symposium and allowing me to interview him about his journey with peritoneal dialysis and with his treatment of choice, and of course experience having PD assist. So can you tell me something about yourself, Mr. Obi?
Okay, first of all, I'd like to say good afternoon to the NKF Foundation and Dr. Bhalla. My name is Russell Obi. I'm an 81-year-old retired coach from a middle school and also a pastor. Married with 6 girls and three wonderful grandchildren. I would like to say that this is a most profound clinic that I have ever been to. Not that I've been to them all, but this is a family to me here. And I know everyone, and they're my family. And I feel so great. From the first time I went in to get an ultrasonic and a blood test. And when I got the blood test, I got a call from Dr. Bhalla. And I went to the office and she said, "You have kidney disease." And I looked at her, "Kidney disease?" And she said, "Yeah, you should take care of it right away." Well, being someone that believes in faith, I told Dr. Bhalla I didn't want to do it. So anyway, I left the office at that time. And probably about a month later, I got a telephone call as I was reading. And as I was reading, there was Lerisa. She called me up and she said, "Oh, let's call to see how you're doing, how you were feeling." And I said, "Well, thank you." And from that moment, I said, well, that stirred me up. I said, I better get to the clinic and go see what I can do. So I went in and to Dr. Bhalla and I said that I'm going to go ahead and do it. So since I've done that, it's been real great.
Okay. So our clinic offers Dialysis. So can you tell us about your experience and what's the impact of Dialysis into your life and family?
Well, it's been a tremendous impact because, I wasn't looking for something like that. It changed a little bit of my schedule in my church work, but we adjusted to that, and that's fine. And the experience that I had, I would tell anyone, I think the biggest thing that behind somebody's mind is fear. Fear, that's the biggest thing. And don't know what the outcome. But after I got the training and talked with my doctor, I said, okay, let's go for it.
So how about your experience with Dialysis when I went to your home?
Well, after the training year at the clinic, I had pretty good training. But then I have my nurse, Lerisa, she came out to my house, gave me additional training, which was wonderful, wonderful to have. I felt comfortable. She was like a guest in my house, like, hey, where's this friend? And she was really, really, really great. And she helped me with a lot of things. One of the things she helped me with, I kind of had my supplies in one area, and I kind of had my back to the door. So she said, let's kind of rearrange this. I said, all right. So she rearranged it for me, and that was great. And I said, she is a great nurse. And I would like to say, my staff, completely staffed at the Hayward Kaiser Hospital, is the greatest, even up to the receptionist. So we're like a big, big family, and I appreciate that.
Okay. So I think that's you already said everything. So any last word that you can share with everybody?
Again, I would like to say to people that, let me tell you how I first started. I was getting real dizzy and I was kind of wobbly, and I didn't really realize that I had kidney disease. But once I wanted to get the ultrasound, the blood test, I went in and the doctor explained it to me. So I would like to say to anyone, the main thing that I find out is fear. They don't know what the outcome is. But after you go to the training and everything else, you learn everything about the machine. The machine, when I'm talking about the manual and also the other machine, become part of your life. So I would say to those out there that if you're going through a kidney disease, hang in there. You guys, I can't say about all the nurses, but the nurses and the staff here are great. And the only thing you have to do is follow the training, everything that you read in the manual. A couple of times, yeah, I got an infection, but I don't know how it happened. But nevertheless, they were right there from AA, told me what to do, and I love Dr. Bhalla. that's my doctor. And she's my doctor, and I thank her for that. And I will say to anyone out there, you be encouraged. If someone tell you to go, if your doctor tell you to go and get this ultrasound blood test, I would say go. And once you get there, once you get into the training, I feel like I had so much training I can train. In fact, I trained my wife. She helped me with a lot of things, and that was really good.
Okay. So, it seems like, thank you for, for all those good words. So thank you very much, Mr. Obi, for your personal thought, experience, and life journey with kidney disease and doing peritoneal dialysis until up to this time.
You're welcome.
Yeah. So
Thank you so much, Mr. Obi. Thank you. Thank you. Thank you for your effort in coming to the clinic here today and giving us your time and your experiences. And it was really very thoughtful, very kind of you to do that. Thank you.
Thank you, Neelam, and thank you, Lerisa. I think we owe you a stand ovation of great work you have done. And thank you, Mr. Obi, for this such a wonderful testimony. Thank you. Thank you.
Thank you. I have just one summary slide, just to summarize, what we for PD Assist. I don't know if I'm still sharing it or not. Do you have my slide deck? Just one slide. I just have one slide in the end. I need to reshare. 1 minute. Give me just a second.
Well, when we were waiting, I think Jenny Shin has a question. She says, thank you so much. And how do frail patients continue with PD after the assist period has ended? Lerisa, do you have any comment on that?
Yes, doctor. So actually, as much as possible, I usually try to look for a family member or, a resource person that can assist them. Because, initially, for instance, like I will start the PD Assist, I usually go for Monday to Friday only. So I made sure that if, let's say, they are, there will be somebody who will assist them, even while I'm going to their home. And of course, I can, I usually train that family member. And so far, most of the patients that I assisted, there are family members that are there after the assist. And if there's none, I made sure that they are comfortable already doing it themselves and they recovered from whatever fragility they had.
Right. So Neelam, go ahead with your summary slide.
Okay, so, like we talked about today, Assist PD is a safe alternative, valid for patients who are elderly. If they're also candidates for hemodialysis or peritoneal dialysis, and my emphasis is that it really should be in line with the goals of care. It should be used to expand modality choices, like Mr. OB, who at first actually did not want to do any dialysis, but then once he got trained and got some assistance, he did it, and shift care to home. So, the cost has been an issue in the other countries, and, it has been shown in most of the countries that it is cheaper than in-center hemodialysis. However, it can increase based on the type and intensity of assistance. And it can be improved if one can transition from full assist to partial assist. For example, in Canada, they showed that 23% of assisted PD patients graduate to become self-sufficient. And so with the use of nurse extenders and a mixed model, so that's how they could maintain their cost. And it has shown that it has increased the eligibility by 15%. And that's really all I wanted to say.
All right, we actually ran out of time, but I want to squeeze some question as quick as possible. Are these CAPD or CCPD patients?
Oh,
They're both. Oh, are you talking about Mr. Obi?
General, all the patients.
They are both CAPD and CCPD.
Okay, and there's a lot of question on insurance. We are integrated healthcare system, right?
Right. So we don't really deal with that.
Okay, but Lerisa, you do need a home health nurse license, do you? In order to go patients home
No,
to do?
actually what we did was I did the orientation with home health because I think I did a check, they gave me a checklist to do, and just like their nurses, so that I can do this, I can visit at home and can do some procedure at home. So I think that's good enough for them, is what they said.
Okay, we have to wrap up. Thank you so much, Neelam and Lerisa and Mr. Obi. Thank you for telling your story. Very inspiring.
Thank you.
Thank you.
Thank
Thank
you.
you, Doc.
Thank you.